Hello, thank you for your interest in Orlando Health Orthopedic Residency Program. My name is Joshua Langford. I'm the Orthopedic Residency Program Director. Here at Orlando Health, I like to say that we're a family, and I think that we instill that in the program from the day you get here. And as you progress on through the years, I think you'll see that the family that we create here at Orlando Health is something that will help you grow. We are going to challenge you. It's going to be fun but hard. And it's just a fantastic place to learn how to become an orthopedic surgeon.
Some things change, technology changes, you get new implants in the OR, those things are great. But the overall values and the core values of our program haven't changed. It's always been a resident-run program. I think that's very important. Our residents have a lot of autonomy and we listen to what they say as attendings. Having the only level 1 orthopedic trauma service in the Central Florida area is huge. It allows our residents to get that exposure that they need so they can really get that foundational knowledge and then build off of that as they decide what subspecialty they're going to practice in.
During your time here at Orlando Health on the main campus, we have Orlando Regional Medical Center as well as Winnie Palmer, which is the birthing hospital and women's hospital, as well as Arnold Palmer Hospital for Children, which is Central Florida's only level 1 pediatric trauma center. And I think that what the downtown campus offers is really quite a breadth of experience, again, from pediatrics all the way up to the elderly and in all forms of treatment.
When choosing a residency, there was really 3 main things that I was looking for. 1, I wanted to learn how to operate. 2, I wanted to be able to do research. And 3, I just wanted to be around good people. And I found all of those things here at Orlando Health.
Our curriculum is designed so that you have longitudinal exposure to every subspecialty in orthopedics. Within those subspecialty rotations, you'll get to work with experts in your field and learn not only the basic surgical skills for that subspecialty, but as well as seeing some complex advanced cases.
Coming here, my first year of residency, I was guided through a femoral nail with one of my third-year residents, and from that point forward, it's been kind of this growing process where I was the one being led through cases, and now as an upper-level resident, I'm the one leading my lower levels through cases.
We have a phenomenal operative experience from every area of expertise, and you get your hands dirty early and often, and you get great experience. We are constantly in the operating room, and so you not only are in the operating room a lot, but you're in the operating room with similar attendings, and that allows you to advance your skills earlier and get a high case volume.
I really like that we have didactics every single day, brings all the residents together in the same room so that we're interacting together, as well as it puts our learning into more bite-sized chunks every single day instead of having it on one day in the middle of the afternoon.
One of the things that stood out to me as a medical student about this program in particular were the relationship that the residents had with their attendings. Our attendings are experts in their field. It's an incredible relationship that you build not only for your time in residency, but for your career.
If you look at our graduating residents, they really get the creme de la creme of fellowships out there, and it's all across the United States. We as attending, we've made those connections and we're willing to go to bat for you so that you get those fellowships.
This program, all of the residents have been getting not only the top fellowships in the country, but also their number 1 or number 2 choice, and that has been very consistent for the past 5 to 7 years. So you know that when you come here, not only are you getting a great education, but you're making the connections that are going to get you to the next step in your career.
One of the biggest reasons I came to Orlando Health, because I didn't rotate here as a med student, I came and interviewed and I felt the family relationship that the residents had amongst each other the second I walked in.
Rotating here as a medical student allowed me to see firsthand the culture of the residents and how well they get along and how hard they're able to work together but be happy doing it.
When you walk into the room, you can truly tell that they care about each other, and I wanted to be a part of that. I wanted to be a part of the family that Orlando Health is.
It's not only a great operative experience, it's not only a great educational experience, but the social aspects that you get from this facility and this training are just, that you can't be beaten. Every single person has been welcoming, every single person here has pushed me to be the best surgeon I can be.
I've been interviewing residents for the last 20 years, interviewed thousands of residents, and when I ask them, what are your top 2 things that you look for in a program? Number 1, they say operative experience. Number 2, they say camaraderie between the residents and the residents and the staff. What is the vibe? What is the culture like in a program? And I think our program is unmatched in that regard. Add on top of that a wonderful city like Orlando, a wonderful state like Florida. There's no surprise why we're highly sought after as a great residency experience.
If I had to go back and re-rank residencies, given all that I know now, given my experience here at Orlando Health, I 1000% would choose to come back here. There's no doubt about it.
Knowing what I know now, I cannot see myself not being part of the Orlando Health family, and I truly love my family here.